All right, I'm now joined by Zeina Jamaluddine in the studio. She is the lead author of the Lancet report on Gaza mortality. Zeina, welcome to the studio. Really great to have you with us today to discuss the report on Gaza. Just talk to us about your findings in this report.
Hello. So as your colleague mentioned, we wanted to really understand what was the underreporting by the Ministry of Health. So our findings indicate that the numbers from October 7 till June actually were underreported by around 40%. That means at that point in June, the number that the ministry was reporting was around 37,000 that were killed. In fact, the reality we are based on the study is that the number is higher, and from October till June is around 64,000 people killed in Gaza.
Incredible. And so that was a period, as you say, from October to June. Just given those findings and assumptions, what do you think that figure could be now in January 25?
So the study really pinpoints this period and shows a 40% underreporting. It's a big assumption to assume that after June, what happened? We could assume it is still 40%, and that means there is around 77,000 killed. However, this is an assumption. It might be that it might be higher or lower. This period was not covered by the study.
And tell us a bit more about your view on mortality rates in Gaza.
So I want to point out that, as your colleague mentioned also, the mortality rates are quite high. This has been talked about by the UN, by different reportings from different agencies. And what we wanted to point out that it's not only what the ministry is saying, it's even higher. And what we focus on in the study was just the traumatic death, but it's also possible to have non-traumatic related death that we've heard a lot about. And this might also increase the mortality estimates that we're presenting.
Now, a lot of people will be asking how you conducted this research, how you came to these numbers. Talk to us about those methods.
So we relied on a method called capture-recapture that ecologists, epidemiologists, and different scientists have used to estimate population sizes. And it has previously also been used in mortality estimation in Kosovo, in Colombia, in Guatemala, in Sudan, for estimating mortality during wars. And it relies on different lists of mortality. So you might be aware of the mortality lists of names of people killed reported by hospitals. You have this listing. You also have another listing of mortality from people reporting by a survey. So I open a survey and I report that my brother, my husband, was killed during this war. And finally, we rely on a third list that's social media obituaries. So people on Instagram, on X, on Facebook report that their relatives were killed with a picture and name. We use all of these lists of data, we clean them, and we look at the overlap to understand how many individuals actually appear on multiple lists. And based on the overlap, we can understand the total population that was killed, so those that are unnamed, to understand how many people were under the rubble and so on. I want to emphasize that these methods have been used in different war settings, and to say that we did attempt to do multiple statistical modeling with those, and I'm happy for people to go and read the methods over this.
Absolutely. And of course, as we heard from Ashraf, this number didn't come, the underreporting didn't come as a surprise to him. And, we've been speaking so much about people under the rubble, unaccounted for. But just to sum up, how significant do you think these findings are from such a prestigious journal, The Lancet, today?
Today, what we wanted to focus on is the fact that with the attacks on hospitals, systems have degraded. The electronic health records become worse in war. People are not accounted for. We wanted to understand by which extent and put a number to this. This is based on the information that we currently have and the lists that we have. Of course, we could do surveys on the ground, but today the reality is we need food, we need medication. Doing proper surveys on the ground is not the priority. But this actually puts the number that the ministry is saying that already people is saying is quite high is even higher. And these are one of the highest, very high mortality rates. If you look at children under 5, children under 10, 15, 20, under 18-year-old, these mortality rates are quite high. The other point that I want to point out is accountability, that to make sure good documentation and tracking of what happened till this point of the war and accountability for what's happening currently in Gaza.
Absolutely, and that is an important point to finish on, accountability for what's happening in Gaza. Thank you so much, Zeina Jamaluddine, lead author of the Lancet report on Gaza mortality. Thank you for coming in.
Thank you.